Charmaine Webster from ACHC Health Coaching Podcast, Coaching to Save Lives. Today we have Mr. Lewis Bertus PA-C, Health Coach, owner of Diabetes 180. I would like to welcome Lewis to our show.
All right.
Hi, Lewis.
Thanks for having me. Appreciate it.
Absolutely. Lewis, tell us a little bit about yourself. I'm so glad to have you here with us today. You are passionate about health and natural healing of the body. Tell us a little bit about your business, your expertise in diabetes 180, and how it's affected your clients.
All right. Well, I guess that's a good place to start. Like you said, my name is Lewis Bertus. I am a physician assistant, and I've been working as a physician assistant for about 4 years now, and family medicine. So I've been dealing with a lot of people with chronic diseases, as family doctors do, and treating diseases like diabetes. And of course, as we all know, doctors and physician assistants, we specialize in medicine and treating symptoms. But I know from a long time, the way I grew up, and just things I've come to understand that healthy lifestyle choices are the key to reversing chronic diseases, where medicine only treats the symptoms. Healthy lifestyle choices actually reverses disease. And so I've always been kind of conflicted, even in my practice, because I'm teaching people about their health and I'm trying to encourage lifestyle changes, but most of my patients, they just want medicine, but once in a while you find people who really don't want medicine. They want to change. They want to reverse their disease, and that's where education comes in. But I found it very hard to make a difference because you're seeing your patient once a year, twice a year, at most 3 times a year. You really can't hold them accountable. So I decided that I would start a health coaching business, a business where I could teach my patients, or I should say clients, how to make healthy lifestyle choices that last and leave a lasting effect, strong enough to even reverse diseases like diabetes. I can also go into my wife's story because it really is linked in to this business and how it started. So my wife, she actually had diabetes for over 8 years and struggled to find the right medications as well as the right diet and lifestyle to keep it under control. And her story is actually similar to many of my patients' stories. They're consistent with the medication. They're compliant. Often the medications they take cause 3 or 4 side effects they don't like. So you gotta find another medication or to counteract that side effect, or So it could be messy, But she tried her best. But no matter what medication she was on, even insulin, even to the point of being on insulin, which works for many people, as a type 2 diabetic, however, is not ideal. And we can go into the science of that, but medicines weren't doing it for her. A1C stayed elevated in the 8 ranges and higher. And then the diet she tried, she went from trying the vegetarian diet that many people say is good for diabetes. She tried low carb diet, which is good for the people say is ideal for diabetes. She tried keto diet. Now, keto diet worked pretty well, and I know we can go into the keto diet later, but all these.
I interject.
Go ahead.
I want you to go into that in a moment. Don't go.
Sure, I won't go too far into it. But keto
you.
diet, yeah, that's a loaded topic. But the keto diet, I would say, probably controlled her numbers the best, but they compromised other things. And the keto diet is very hard to comply with too. It's a very difficult diet to stick with. So she knew she had to make a change, and I was convinced that if we found the right diet and lifestyle, we can reverse this disease. So I plunged into research. I read as much articles as I could, read books on it and studies on it, ranging over. Some of these studies go back 100 years, and I realized that there was a consistency in a lot of these studies, and that is if you put a diabetic, whether they're type 1 or type 2, on a diet that is low in fat and rich in whole foods,
Mm.
right? We'll talk about what that is. You can reverse diabetes. And when I put my wife on this plan, when I kind of coached her on this plan, she and it took 6 weeks. 6 weeks she was off medicine.
Oh.
6 weeks, her blood sugars
Mm.
went from being in the 200s, 300s range to low 100s, 120 and lower. And just 6 weeks. I mean, medicine can't do that. When you have
No.
the right lifestyle, right, the right diet, and of course, other things like intermittent fasting, exercise is also key. And you put the right lifestyle together, you can reverse almost any disease, chronic disease, especially diabetes, type 2 diabetes. And it could also benefit type 1 diabetics as well. So that's what
This
launched
is
me into
so
this
great.
plan.
This
Yep.
is and this is the whole thing that we're talking about, how to take the diet that you have
Hmm.
and help heal the body. And I'm so happy you mentioned that. And thank you so much for that story about your wife and how your wife overcome diabetes. That is so important. And I think this is a key component that a lot of people could learn from.
Hmm.
So thank you for that. So Lewis, please share with us some of the food sources that people can use who are pre-diabetic or diabetic, and what they should be aware of while implementing such a diet.
Okay. So the first thing they need to be aware of is to re-educate themselves on what sugar means, right? So unfortunately, and we're doing better, even as physicians, we're starting to
Mm.
understand the science a little better. But unfortunately, there's a lot of misunderstanding and miseducation because we as physicians don't get a lot of nutrition in school. So traditionally, when we think of sugar, we think of anything that's has carbs in it, whether it be fruits like strawberries, pineapple, banana,
Mm.
or soda, and or pastries and brownies, right? Or bread and pasta. We lump
Mm.
all that as sugar. But the thing is, sugar should be differentiated from carbohydrate. Okay, so a sugar
Yes.
is what happens when you take a carbohydrate and you process it, you refine it, you strip it of its fiber, you strip it of its nutrients, and you get the white stuff, right? The powdery stuff that tastes
Mm.
sweet and good. That's what sugar is.
Mm.
And that is what you need to eliminate from your diet, right? The
Right.
carbohydrate, the original plant source of that sugar, whether it be pineapple, banana, whatever, strawberry, mango, that is the stuff you do not need to eliminate. You need to find a way to include that in your diet. So, number
Mm.
one,
Mm.
understand the difference between sugar and carbohydrate, right? Sugar is the white stuff, the stuff that they add to pastries, the stuff they add to boxed goods like cereals, the stuff they
Mm.
add to flavor and enhance food. That's what you need to eliminate. Okay,
Mm.
so I teach my patients and my clients that they need to learn to fall in love with fruit again. All right, so just
Mm.
get this idea that you can't eat fruit out of your head.
Most Right, because a
Mm.
lot of patients, a lot of people are afraid of fruits.
Yep,
If you mention fruits, oh no, no,
no,
no,
I
I
can't
can't
eat no
eat that.
fruit,
I
right?
can't eat
I
fruit
can't eat
because
fruit.
it's going to shoot my sugar up.
Yep.
And that is something that I hear all the time. And that is a key point. So knowing the difference between the additives to the foods
Yep.
and the natural sugars versus the pre-made sugars, we'll
Sugars,
say.
exactly. So
Okay.
that's key number one, right? But obviously, I
Mhm.
say key number one because there's more to the story.
Right.
So if you're going to you want if this is particularly for those who want to reverse their disease and not just manage the symptoms. If you're okay with just managing your symptoms and taking medicine and controlling it, then that way that's fine. But if you're interested in reversing your disease and actually get, or at the very least, controlling it with your food instead of medicine, because some people get to the point where that at the very least they're controlling it with their food, and their medicine they take is very minimal, right? So everyone's how I should say success varies, right? Some people they find themselves on medicine still on a healthy lifestyle, but it's very minimal compared to those who eat however they want to eat. So I want to put that as a disclaimer. But for those who want to get the best results, understanding the whole story. So number one, the difference between sugar and a whole carbohydrate, and number two, understanding that if you want to eat the whole carbohydrate that's healthy for you, right? You gotta decrease the amount of saturated fat in your diet.
Mm.
So
Decreasing the saturated
fat
fat,
in your
right?
diet, because what we have found through research, and this again goes back to 100 over 100 years of research, it's a high fat diet that causes your body to not respond to insulin, or in other words, cause insulin resistance. The more fat you have in your diet, the harder it is for your body to process and become sensitive to the carbohydrates you eat, whether it be fruits or bread or and things like that. So you have to decrease the fat in your diet, and you gotta get rid of the processed sugar in your diet. That's
What
a
type of
summary.
fat? Can you define high fats for us? Is that
Yeah.
animal fat,
Okay.
or what type of fat are you talking?
All
Give
right.
us a little definition
So
there.
good question. So what's many studies have shown that the happy percentage for a diabetic, right? So if you already have diabetes and you're looking to do your best and minimize medication, then you want to get to a 15% of your total daily calories being fat, right? So your fat percentage should be no more than 15% of your daily calories. Normally, we eat much more than that. If you were to track your food, most of us are eating 40% or more of fat. Some as much as
Right.
60% fat in our diet, right? So it does require a drastic change. Current guidelines say that a healthy individual would have 30% fat. But really, if you want to maintain your disease, then go ahead and eat 30% fat. But if you want to reverse it, if you want to start to experience less medication instead of more medication over time, that many diabetes struggle with, then you want to get down to 15% of your total calories being from fat. The best way to do that is to eliminate animal products, right? Because animal
Okay.
products such as meat, dairy, cheese, poultry, even fish are naturally high in fat. You can't avoid that. They're high in fat. They're high in fat, and they're specifically high in saturated fat. Saturated fat is a fat that is known to increase chronic disease risk, and increase the risk of diabetes complications. So
Mhm.
if you replace animal products, animal fat with plant-based fats, then you're going to find yourself a lot easier to get to the 15%, and you're going to find yourself reversing chronic diseases like diabetes.
Wonderful, wonderful. And that was the key point I wanted to bring out. So, some key points you just mentioned is knowing the different types of sugars
Yeah.
and identifying high fats. And
Yes.
if you can lower your fat to at least 15% or less, animal fat, that is,
Yeah.
right?
That's
And a
right.
replacement with a plant based type of diet,
Yep.
right?
That's right. Yep. hmm
Okay. Okay. Thank you so much, Louis. This is so good. So my next question to you is, give me a couple of statistical measures where you have worked with your clients
hmm
and you have implemented this plant-based type diet that
Okay.
have been effective in their health.
Okay. So thanks for asking that. So first off, I want to make sure it's clear too that when you say low fat and replacing animal fat with plant fats, we understand that plants have fat in them too. A lot of people don't realize that, but especially, and we'll go probably more into this, but you have to understand that if, even on a plant based diet or a vegan diet, you can have too much fat, which
Oh,
is
okay.
which is what my wife experienced. I would say my wife is my first client, right? My first client was my wife, and I experienced the difference between when she was vegan or vegetarian, because she's been vegan vegetarian with uncontrolled sugar. It wasn't
Okay.
until we lowered the fat to 15% as a plant whole and made sure that she was eating wholesome foods as well, that she started to see results fast. So even as
Amazing.
a so-called vegan, we got to make sure that we're not eating a lot of oil, a lot of nuts, a lot of avocados, seeds, those
Mhm.
things that are good for us, but as a diabetic, they make sugars hard to control. Um, so of course, as a physician assistant, I have hundreds and hundreds of diabetic patients over the years in many different areas of practice. I've worked in prison systems, I've worked in family practice system, I've worked in urgent care, I've worked a lot of different places. I've worked rural areas, I've worked in urban areas, I've worked in suburbs, and those who followed my advice see results. So I would say that my
Mhm.
first statistical analysis is the difference between those who actually try to make lifestyle changes versus those who don't. And I can tell you, as a physician assistant who's been working with diabetics, and I say hundreds because I can't tell you how many, though those of my patients who come to me after a 3 month or 6 month lifestyle change, they see results. Recently I could think of one African American male I worked with who had an A1C of 7.8, and
Mm.
he started making changes. He started practicing fasting. He got rid of meat and dairy, eggs. He got rid of processed sugar in his diet. Right. He started exercising more, and in 6 months he went from 7.8 to 5.8.
Look at that. Look at
And
that. That is
he's now
awesome.
pre-diabetic. He's not even diabetic anymore.
My
Um,
goodness.
so, and he's excited. He feels energetic. He lost I can't know how many pounds, about 10 pounds. And he feels wonderful. He feels great. Um, so after that, as far as clients, paid clients, I just started my program about 6 months ago. So I've been working with individual as a paid client. So that's different than a patient, right? Someone who's actually enrolled in the program. And this
Mhm.
individual is just an amazing success story as well. So he was actually at the brink of death not too long ago, struggling with high blood pressure, heart failure, ending up in the hospital, you know, um, short of breath all the time, overweight,
Mhm.
and this was a direct result of a lot of the stressors he was having in his life. And this was he's not old. He's in his late 30s, right? So he's not very
Mhm.
old.
Young person.
But he went through
Mhm.
so much stress in his life that he got to the point where he didn't care whether he lived or died, and it was
Mm.
reflected in how he cared for himself.
Self,
He
right.
ate whatever, whenever, whatever. you know, and this is why I think it's very important for us to take care of our mental health it,
Yes.
before we even
Mindset. Yes.
try to be healthy. You can't take care of your health
Mhm.
unless you take care of your mental health is in charge. So
Mhm.
by the grace of God, he went through counseling and therapy before he started working with me, and he started getting in charge of his mental health, and he found out that he has a lot to live for, right? And so in finding this out, he knew he needed to make a difference in his life, especially when it came to his diabetes, his high blood pressure, and his weight. So he started making this change, and we started to work together. And he experienced a drop in his A1C as well. His A1C at the highest level was 8.4. Now today it's 6.4.
Amen.
His
Oh my gosh, you're doing this
he
thing.
experienced a 10-pound weight loss. His energy is restored. He still has some ways to go because his goal is diabetes reversal, and I believe he can do it. So he renewed his contract with me, and we're still working together week by week, and reaching his goals. And so it's just something I'm seeing with my own eyes, and I've seen and known for years. I'm excited to give this service to the public so they can experience the same change.
Mhm.
Yeah,
This is so gratifying. Doesn't it make you feel so good
it
to
does.
see the
It
turnaround?
does.
And you can see some, especially this young man in his 30s.
Mhm.
He came to you in one state of mind and physical being,
Yeah.
and then you walked him through a coaching session or
Yes.
so,
Yes.
and you're starting to see him change
Yep.
slowly. And you see the change in the mindset, the change in the health and the body.
Yep.
So this is the real deal. And I encourage any and everyone to look at coaching as an option
Hmm.
when it comes to diabetes and all other aspects of their life.